Hello, everybody, and welcome to our Tuesday evening. As I'm going to be saying again, I apologize in advance if some of the information is a little bit technical and higher grade. It was the only stuff I could find. Sally challenged me a little bit on this one. Hello, Sally. So I'm going to run through it and hope it all makes sense and hope it can help a few people. So we're talking on a thing called PCOS tonight, which is polycystic ovarian syndrome. Share this. Okay. So PCOS and infertility often go hand in hand because of the issues. Now, PCOS, as I've said, is a polycystic ovarian syndrome, and poly meaning many, cystic meaning cysts or infectious nodules, and obviously an ovary. So you can imagine that if the ovary is not operating correctly because of cysts, infertility is going to go along with it. Now, it might be a temporary thing or it might be a permanent thing. Right, so what is it? Some of the symptoms that you'll see are trouble conceiving, mood changes, acne, fatigue, insulin resistance, and you'll find insulin resistance features a lot in these sort of things, high testosterone levels, male pattern baldness or thinning hair in females, obviously, irregular or missed periods, a low sex drive, ovarian cysts, which is obviously the common one, weight changes and trouble losing weight, and excessive body hair growth. So polycystic ovary syndrome is associated with hyperinsulinemia. Sorry, that's one of the big words. And it's hyper meaning more than, and insulin meaning sugar, and anemia, if I'm not mistaken, meaning lack of, and insulin resistance, the causes of which remain unclear. So the really fancy term that they use for this is idiopathic. Anytime a doctor tells you a condition is idiopathic, it doesn't mean you're an idiot or he's an idiot. It means he has no clue what's caused the problem. It has long been recognized that nutritional status and body weight can have profound effects on reproductive function. And this can be in both male and female. It is important to note that PCOS is not exclusive to obese women, but it also occurs in lean women. Sometimes with slightly different symptoms, but it is there nonetheless. It seems clear that environmental factors such as eating habits play an essential role in preventing and treating women with PCOS. So we've seen in previous talks that I've done that environmental can be not just diet, but can also include things like pesticides and toxins in your vicinity. So look out for the toxins in your cleaning products at home. Look out for the toxins in your clothing. Look out for the toxins in your personal care things that you're using as well. All of those can create issues. International recommendations indicate that weight control is one of the main treatment strategies for PCOS, since obesity worsens the clinical presentation of this syndrome. So obesity isn't the cause in most cases, or in a lot of cases, should I say, but does not help the situation. And this is true for a lot of conditions. Unfortunately, being overweight or obese does tend to cause a lot of knock-on issues. Non-obese PCOS has a similar risk to obese PCOS by having a similar amount of visceral adipose tissue. sorry again for the big words, visceral meaning gut, so it's that hard fat around the belly, around that proverbial spare tire. Adipose meaning fatty tissue. And this is corrected for body weight. So the amount of this goes according to how much body weight you have as well. There is evidence implying that vitamin D deficiency occurs commonly in obese PCOS patients. Again, and the more research I'm seeing at the moment, the more issues I'm seeing as well, the more it seems to show that vitamin D deficiency is a key. So we need to be pushing our vitamin D. We are in summer in Africa, for those who are watching internationally. So we don't really have a lot of excuse for not getting sufficient vitamin D by being outside. Just be careful you don't get too much and burn yourself. Oxidative stress and low-grade inflammation are two characteristics shared equally by obese and non-obese patients with PCOS. And oxidation, once again, is the human body's version of rusting, essentially. And then obviously inflammation. Inflammation will always accompany problems. So what do we do? Some of the foods that one needs to avoid: gluten, sugar, dairy, soy. Now, this is research I've picked up from various medical sites. So when we say soy, obviously we're talking about the incorrectly processed soy. We know that with Neolife, they process the soy in a different manner. So it is not as much of an issue as soy is generally accepted to be. Alcohol always plays a role in issues. Highly processed carbs, another issue. Coffee and seed oils, like sunflower seed, canola seed, that sort of thing. Those are the problem children. So nutrition is one of the major modifiable environmental risk factors for several non-communicable diseases. That really is a bit of a mouthful, but it's basically your nutrition plays a big role in your health. And it plays an essential role in the prevention of these non-communicable diseases. And non-communicable diseases are things like PCOS, like diabetes. It means things that you suffer from that you cannot catch from somebody else. As we've all learned, one can catch COVID from being too close to somebody else who is positive with COVID. You cannot catch a heart attack from someone else who's had a heart attack. You cannot catch diabetes from another diabetic. Those are non-communicable. And nutrition, as I say, is an essential role in their prevention and initial treatment. Now, in my opinion, prevention is significantly less painful and also cheaper than cure. Weight loss is usually considered the first-line treatment in women exhibiting the obese phenotype, meaning body type, which in lean women is not needed to lose weight. So basically, if you are suffering from PCOS and weight is an issue, speak to a dietitian or a clinical nutritionist and find out how you can safely lose the weight. Lean individuals with PCOS must be encouraged to consume a healthier diet in its composition, like increasing vegetables and fruit daily, to ensure they have an adequate supply of various minerals, vitamins, and nutrients. And once again, if you're not getting it from your diet, please supplement correctly. And when we supplement correctly, we use food-based supplements. So skinny people, for want of any better terminology, need to be careful what they're eating, because quite often skinny people have just as bad a diet as overweight people. And I've seen some extremely skinny people who live on cigarettes, coffee, and toast. That is not a healthy diet. One of the goals of patients with PCOS is on supporting their body by promoting healthy hormonal balance. Obviously, the hormones play a big role in this. have a good uterine lining. They need regular ovulation. They need to improve estrogen metabolism. And these could be achieved by vitamins and minerals such as calcium and vitamin D. So classic one there for us in our case is CalMag, as well as some medicinal herbs that promote hormonal balance and support regular ovulation. Sorry. So an ovarian cyst, this is a bit of a graphic picture of what an ovarian cyst looks like. On, if I can point out over here, the left is your cyst, on the right is a normal ovary. You don't want this one on the left-hand side. Ovarian cysts form for numerous reasons. Again, that idiopathic story, we don't know why. The most common type is a follicular cyst, which results from the growth of a follicle. Now, a follicle is the normal fluid-filled sac that contains an egg. So it's an egg that doesn't quite develop. Follicular cysts form when the follicle grows larger than normal during the menstrual cycle and does not open to release the egg. So think of a grain of popcorn. With your egg or your follicle that forms to develop an egg, if your egg doesn't, or your follicle doesn't open, it's like that hard popcorn shell. A normal release would be the egg opening up pretty much like a kernel of popcorn. Both benign, which is non-cancerous, and malignant, which is cancerous, tumors of the ovary may also contain cysts. So a cyst may not necessarily mean cancer, but cancer would almost generally have a cyst. A condition known as a polycystic ovarian syndrome, or PCOS, is characterized by the presence of multiple cysts within both ovaries. So in this little picture, on the left-hand side is a single cyst. Now imagine that with numerous different types of that in both sides. PCOS is associated with several hormonal problems and is the most common cause of infertility in women. Doctors aren't sure what causes ovarian cancer. They have identified, though, several risk factors. And these include age, specifically women who have gone through menopause. Smoking, obviously it's a problem in a lot of things. Obesity, not having children or not breastfeeding. However, using birth control pills seems to lower the risk. And that, in my opinion, would mean because of the change in the hormonal structure. Taking fertility drugs, such as Clomid. I don't know what the name of the fertility drugs are over here. Hormone replacement therapy. Family or personal history of ovarian, breast, or colorectal cancer, and those having the BRCA gene can increase the risk. So if in doubt, please see a doctor, let them do blood tests, let them check your history, check your and maybe do some gene tests to see what your risk is. And normally when medical people talk about increased risk, it's in the region of about 10 to 25%. So it's not a major risk, but it is an increased risk. So what are the symptoms of ovarian cysts and tumors? Pain or bloating in the abdomen, difficulty urinating or frequent need to urinate, a dull ache in the lower back, pain during sexual intercourse, painful menstruation and abnormal bleeding, weight gain, so unexplained weight gain. So if you're not eating a packet of donuts on a daily basis or feasting on junk food and you're still gaining weight, something to be concerned about. Nausea or vomiting, loss of appetite, and feeling full quickly. So you've had a little piece of lettuce leaf and suddenly it feels like you've had a massive plate full of food. Now, please remember that these are symptoms. And these symptoms are common to a lot of other problems. So if you see these symptoms, it is just a matter of being aware, check it out. If in doubt, see your doctor. Let him work it out. Because when you go to see a doctor, what they do is they take a clinical history, they have a look at all of your symptoms, and essentially they rule out what the problem isn't so that they can try and figure out what the problem is. So you go to your doctor and he says, well, let's do some tests. What he's doing is ruling out what the problem isn't. Some of the recommended supplements include things like your feminine herbal. We spoke about the herbal products that can be used. And I've put in phytodefense, although this was not specifically stated, but we talk about the cruciferous, which works on hormonal issues, flavonoids, which is an antioxidant, and your carotenoids, which is also an antioxidant. So this is something that I picked up in one of the sources that I went through with all this research. So Formula 4 Plus or Formula 4 and Treonine. Again, my personal opinion, I prefer Formula 4 because it has got iron in it, and Treonine instead of the Formula 4 Plus, purely because the Formula 4 Plus does not contain the iron, and the Formula 4 does. And I feel that, especially now that we do not have an iron supplement available, most people, specifically ladies, need iron. So feminine herbal complex is another one. Cruciferous Plus, carotenoid complex, chelated zinc, and remember, any mineral should be in a chelated form, and Beta-Guard for detoxification, but also because it's got the extra zinc and the Bs and various other essential nutrients that are there, not just to detox us from chemotherapy, which it was originally developed for, but also to boost your system in other ways. Now, male infertility is also a problem. My late brother-in-law had an issue, and they never did figure out what the problem was. They knew that as a couple, they could not have children. And it was worked out much later that he was the problem. And we really don't know. Unfortunately and sadly, he did die of lung cancer a good few years ago now. But he also had a diet that consisted mostly of chocolate and sugar. So I don't know what caused the problem, but male infertility is actually becoming a very common problem these days, and a lot of it is diet related. I actually listened to, I think it was a Jim McAfee talk somewhere along the line, who was saying that male infertility is increasing on an annual basis to the extent that at some stage it is possible that the human race could breed themselves out of existence. And I must say, by seeing a lot of ladies who are having seizures, the predominance of female babies to male babies is quite significant. There are a lot more female babies being born than there are male babies. So some of the things that causes male infertility, varicose veins in delicate areas, hormonal abnormalities, the use of testosterone supplements, and this happens a lot with your athletes, specifically in the gym area where these guys are trying to put on huge amounts of bulk, and they're taking testosterone supplements and using protein shakes that have got issue or things like testosterone in them, and that in turn leads to infertility. So those are just some of the things. And recent research suggests that male infertility is a common problem. researchers have found that the higher quality omega-3 fatty acids of EPA and DHA improve the vitality of sperm and improve male fertility. So if somebody is having a problem, suggest to them that they get onto our salmon oil. Recent analysis by Hosseini and Associates concluded the following. This meta-analysis indicates that supplementing infertile men with omega-3 fatty acids resulted in a significant improvement in sperm motility and concentration of DHA in seminal plasma. Big fancy words, but DHA also plays a major role in development of the brain. Now, some omegas, your plant-based omegas, don't have DHA. They do have EPA. So this is something that we need to advise people on when they say, oh, but I'm taking an omega-3, it's plant-based. They're not getting what they need. Another study repeats the emphasis on omega-3 fats, but also mentions the apparent importance of cereal grains. We're talking threonine and fruits and vegetables, namely carotenoids. And these researchers wrote, studies have indicated that in men with idiopathic, there's that fancy medical term, infertility, omega-3 intervention resulted in significant improvement in total sperm count as well as sperm cell density. Moreover, several studies have shown that higher intake of poultry, chicken, and I'd say not just chicken, but more especially turkey, because turkey is a very good source of zinc, just by the way. Cereals, fruit and vegetables may play a beneficial role in male infertility. So the suggestions are things like ProVitality, because that contains your salmon oils, your carotenoids, and your whole grain oils. Salmon Oil Plus, threonine, carotenoid complex, and the Neolife Shake, because that is your protein with the amino acids. Remembering that is almost your catalyst, for want of any better terminology. If you mix in, if you're ever making resin, you mix in two things. One of them is a catalyst to enable it to work correctly. So vitamin E and infertility. Again, we go through some of the reasons for not falling pregnant. And infertility is becoming an increasing problem in the United States. And I seem to think not just the US, but also other parts of the world, including here in South Africa. Couples often go to extraordinary lengths in attempts to conceive a child. And some of those lengths are incredibly expensive, because I know some people who have gone through this before they could conceive. A recent study found that male infertility may be improved by supplementation with natural vitamin E. And by natural, I would suggest whole food vitamin E, because natural vitamin E in a lot of cases actually derived from crude oil. Crude oil is natural. I don't want crude oil in my system, thank you very much. So the intake of vitamin E at dosages of 100 milligrams 3 times a day was shown to improve numbers of sperm, mobility, and rate of pregnancy. So I would suggest vitamin E and cover all your bases. Throw in some salmon oil as well. Early animal studies showed that it was difficult to carry a pregnancy to term with vitamin E deficiency. So the moms also need vitamin E. So omega-3s during pregnancy and lactation, it is vital. And they are critical from, I would say, probably before the start. Eating well is always a good practice to pursue for everyone, young and old. But assuring your body is getting the right nutrition is never more important than it is for women of childbearing age. So, as we know, our omega-3, our Salmon Oil Plus, is one of the only omega-3s that I am aware of, and I am under correction, but it's the only one that I'm aware of, that has been approved by the Royal College of Obstetrics and Gynecology in London, and they do not approve just any product. But they were shown the research and they proved it. So for those young moms who go to the gynae who says, oh, you need omega-3, but be careful, you shouldn't have it during pregnancy because it could contain heavy metals. Please, they do desperately need that omega-3, but they need a pure one. For women, positive relationships between omega-3 intakes during pregnancy and infant birth weight, as well as subsequent visual and cognitive development of the infant, have been reported. And that is, some of the reports that I've seen are an increased IQ, and the children being able to read an extra line on the eye chart with those who have had sufficient omega-3 during development. Postnatal benefits of omega-3 fatty acids can be seen during breastfeeding when moms transfer DHA through their breast milk to their developing infant. I may be biased, but I do believe my granddaughter is an indication of this, having walked early and starting to form words already, and she is only barely a year old. In addition to the tremendous benefits during pregnancy and lactation, it appears that omega-3 can even help in relieving symptoms of primary dysmenorrhea, a condition where women may experience severe, painful menstruation symptoms. And there were marked differences in the women who took omega-3 for pain intensity, along with fewer painkiller tablets used as a rescue dose. Vitamin B in pregnancy. Another vitamin B of importance is folic acid. Folic acid or folate or vitamin B9 is important for many functions. It is involved in the production of blood cells and DNA for new cells. It helps in the prevention of premature births and low birth weight babies, and for the prevention of neural tube defects that can most commonly occur during the first 3 months of pregnancy. So for those wanting to fall pregnant, please get them onto folic acid as soon as possible, or vitamin B in its entirety. The increase of folic acid in the body, there is another vitamin that plays a large role with folic acid, the production of red blood cells, and that's vitamin B12. So that is why I would recommend a vitamin B complex, not just folic acid and or vitamin B12. And interestingly enough, while vitamin B complex has got a good source of folic acid, there's actually a higher source of folic acid in our lipotropic adjunct. This vitamin is vital for many groups of women: pregnant women because of its involvement in a baby's development, vegetarians because vitamin B12 is obtained from animal products, and adults older than 50 because of the reduced ability to absorb vitamin B12. And that is the end of my talk. I hope it wasn't too technical. We've got about 5 minutes. So if anybody's got any questions, please unmute yourself and fire away, and I hope I can answer you. Linda, you're muted. You're muted.
Oh,
There.
sorry,
Okay.
I didn't press hard enough. Sorry.
Okay.
Yeah.
Yes.
Sean, what about zinc? Zinc for male fertility. I've always learned that zinc is so important for male fertility.
Yes, very important. And I didn't touch on it, but because zinc didn't really feature in a lot of the articles that I did go through. But yes, zinc is vital as one of your fertility things that you need for the male. So I would say zinc, vitamin E, and omega-3 for both male and female.
Yep. Okay. Thank you.
No problem. Anybody else?
Sean,
Yes.
I found that lipotropic was fantastic.
Yes.
It contains more folic acid than the vitamin B.
Correct. So while vitamin B is good, lipotropic does have more folic in it. And as far as I'm aware, you can actually take both of them together.
Yeah, I found with Erin and her baby, she had the folic acid mainly because you know, they couldn't, the vitamin B complex is quite expensive, whereas the lipotropic is actually very reasonably priced.
Yes, correct. My sister-in-law had the same thing, and that is where I actually learned about that. She did more research than I did, and she informed me originally that the lipotropic had more folic in it, and she was using that as well.
Yeah.
Sean,
Sorry.
sorry.
Okay, go Sally. Sally, talk. Go.
Sally, I was just saying how nice it is to have you back.
Sean, I just want to thank you for a very comprehensive study. I didn't realize how much supplementation and all the supplements is so important. But thank you so much, Sean.
That's a pleasure. Thanks for challenging me.
Thank you. There's somebody in my team. There's somebody in my team that has this problem, and I was also trying to sort of like sort it out with her. So she would love to listen to this.
Good. Please go ahead and share it. Well, I'm going to stop recording.
If we've got time for a testimony, was actually Jenny Holiday's and our testimony.
Okay.
You've probably heard of
We've got 2 minutes.
a couple. Yeah, a couple couldn't have children for about 12 years. We put them on the formula for the zinc and the omega, and the vitamin. Of course, we didn't have lipotropic in those days, and vitamin E, both of them. And they had 2 very, very healthy, wonderful boys who have now got children of their own. So, yeah, it was one of those testimonies when we first began that meant so much to us. I think Bill and Carol were one of our first downlines from Jenny Holiday.
Okay, excellent. Yes. And sometimes it's just those simple little things that make such a very, very big difference. I know Louis Smith has got some testimonies like that from some of his team as well.
A team member of mine also fell pregnant after years and years of battling when she started taking these, mostly some of these supplements that you mentioned, omega-3, and I can't remember the else, but she put it down to the omega-3 anyways, but she battled for years and years.
That omega-3 has got so many uses and functions. Somebody once commented that if they told you everything that omega-3 was good for, they would sound like a snake oil salesman, because it's just good for everything.
Yeah, absolutely. Oh, omega-3 is like the product for everything.
Very definitely.
1 minute to go. Thanks very much, Sean. Thank you, everyone, for being on this chat. We had a lovely lot of people. Sean, well done.
Thank you, Sean. Yeah, thanks for that.
My pleasure.